Welcome everybody to our June edition of the Journal Club. It's great to have you all with us, and I'm really excited today. We've got a topic that feels like a bit of a segue into something a bit different to the very reflexive work that we've been focusing on in the past journal clubs this year. And thank you to Megan for offering to present today. I think this is going to be quite an interesting discussion, especially since a lot of us are working in spaces with health science students and thinking about also doing research and involved in research that involves the scholarship of teaching and learning. So really looking at health education. So I think it's a nice diversion from some of the reflexive topics. And also good to look at a different kind of method as well. So something that involves a scoping review, which we haven't looked at that kind of a type of article before. So thank you, Megan. I'll hand over to you.
Pleasure. Before I start, sorry, Jenny, I just want to speaking of that. There's just one slide that I want to. Okay, can you all see
the camera on as well so that people can just see who you are?
Yeah. Hello, everyone. I don't know if you can see me. All right, thank you. Thanks for joining this morning. Like Jenny said, I was trying to decide on a paper to present today, and I thought of doing something slightly different just because we've focused a lot on reflexive practice, and I think absolutely valuable, but I kind of wanted to look at some other things, and I thought, what are we as sort of a multidisciplinary team often involved in? And like Jenny said, I think there's definitely been a shift over the last couple of years of not just focusing on individuals who are actually working in practice in different sort of hospital and clinical and healthcare settings, but kind of bringing it back to students and looking at specifically sort of, again, I think I've always been interested in sort of end user experiences. So there's definitely been a shift in terms of looking at students as sort of collaborators in learning over the last couple of years, rather than just being the sort of top-down education approach. So I thought this article might be interesting. I'll put in a disclaimer that after choosing to do a review as a journal club article, I don't think I will ever choose a review again. Reading this article at one point, I didn't even know what I was reading anymore, and there was just so much information. So I will try to summarize it as best as I can. It was a lot to kind of navigate through, and there was definitely some sections that I don't know if I will completely be able to do it justice in terms of what the authors perhaps were trying to sort of bring across in terms of the arguments and overall summary. So this was a paper that was published in 2025, so last year. It was done by researchers at a university in Geneva as well as in France. And the title is Students as Co-Designers in Health Professional Education, a Scoping Review. So they kind of, before they kind of, right at the beginning of the article, they kind of really put together these two definitions for what they mean as student co-design in health professional education.
Sorry, Megan, we're not seeing slides on our side.
Oh, how come?
They were there and then they disappeared.
Oh, that's weird. It's coming across on mine. Okay, I can reshare. Sorry, that's more tech issues. Share. Can you see my slides now?
Yes, they're popping up.
Okay.
Super, thanks.
All right, and when I toggle, does it move?
Yes.
Okay, sorry about that. So they, right at the start of the article, they put together a definition by what they mean as when we talk about student co-design in health professional education. And they define it as a collaborative engagement between students and teachers in creating, modifying, or improving learning, teaching, and curricula, or as a subset of student-staff partnerships in health education.
Which is quite vague.
Yes.
and what I kept on thinking is, where's the research coming in here? Because a lot of it is co-design of curricula. But how does research fit in there? Does it fit in there? I wasn't entirely clear.
And they sort of mention later on, they talk about sort of the roles of individuals, and research often gets clumped in as like the staff are considered researchers, and they taken as given.
But not research as feeding back into teaching.
Yeah, they don't, like you said, there's not sort of this big thing that this is a research on student co-design. But they do go on to kind of try to differentiate that their review is really focused on the act of student co-design, and sort of that it's an active participatory process rather than just sort of feedback in terms of experiences. So that's kind of what they sort of start off with. In terms of the background, like I said, I'm kind of really just summarizing things here because there was a lot to kind of navigate through this paper. But really the motivation to kind of start looking at the student-staff partnerships in higher education, teaching and learning has really grown over the last 13 years. And one of the big issues is that there seems to be this sort of new buzz term, but there really seems to be a lack of sort of disciplinary perspectives in terms of how is this actually done, the methodologies around it, and there doesn't seem to be clear, concrete sort of empirical research that really shows the process and methodologies of how these things are done. So there, again, in the papers that do exist, there seems, again, to be these variety of terms, like Jenny said, kind of this vagueness of student-staff partnerships can be seen as students being co-creators, co-producers, change agents, co-designers. So again, sort of a real sort of variety of terminology that's used without there being sort of, again, sort of this clear known definition or clear explanation of who's involved and sort of what the correct terminology should be when talking about these processes. The existing literature seems to have quite a narrow focus. There seems to be existing research. The existing research seems to center on role dynamics and relational aspects, not so much the actual co-design process and sort of the structure of how it's done. So again, there seems to be lots of sort of pre and post interviews in terms of experiences. There seems to be sort of a lot of theoretical kind of abstract ideas of this idea of student staff partnerships, but there doesn't seem to be a lot of research in terms of how this is actually done and sort of what the processes involve exactly. So
sorry, for me, what was also missing was the why. So why is this important? Why would you want to involve students? Because it's quite a radical shift from traditional models.
Absolutely.
The lecturer or the faculty delivers content to students. So
yeah,
that I think was not really addressed.
Yeah, and where the gaps are. I also think like the research that exists is so broad in that they kind of look at sort of undergrad levels. They look at, there's a very little research on postgrad level teaching and learning, and a lot of it is from westernized countries, as I understand. So again, you know, the why is so broad. You know, there can be so many different whys, and it all needs to be contextually specific, I think. And what, so again, you know, quite vague to start with in terms of sort of the reasons behind why there needs to be this shift, and you know, sort of the value thereof. There definitely seems to be a gap in studies that focus on health professional education, and they remain limited, and they seem to rely on these broader health education frameworks in general. So not just focusing on health care professional students or sort of the training thereof, but kind of just in general for all sort of higher tertiary education. Again, fragmented methodologies and frameworks. So for their review, they really wanted to look specifically at this idea of co-design within student-staff partnerships in health professional education. So the gap in research really is that they identify as students need to be seen as partners, where it focuses on the roles and relationships of students with their sort of staff or their educators, should I say rather. And the idea of co-design that they have described focuses specifically on the practice of making and designing together.
Sorry, I'm just thinking of myself as a student designing a program.
Yeah, exactly. You have no clue.
No, and
Oh my God, you don't know what you're supposed to be knowing in this course. So
No.
how can you possibly design?
No.
Yeah. So, which is kind of why I was saying, we really need to interrogate the why of, I think that there is tremendous value in involving students at certain points, but you can't just shove them in wherever.
Fair.
No,
No.
exactly.
And I don't think I want that kind of time. I'm here to learn. I don't want to spend effort trying to design a study program.
It's like, just give me the information and help me to learn
I want to
it.
come with a box.
That's how our students still are.
Yeah.
I've paid money for this degree.
So now you're telling me
I'm this designer.
I must pay for the degree and design.
And I think the other thing is nobody ever tests them 5 and 10 years down the line saying, what kind of clinical expertise do you have?
Yeah.
And that's always what I have a problem with any kind of intervention. It heavily relies on questionnaires and it doesn't actually have an outside metric of did they learn what they were supposed to?
Yeah, and was it helpful to be part of some kind of a co-design approach?
And it
I
needs
guess
to
you
be a
don't really
long-term
know.
study.
Yeah.
Yeah, you can't just do it at the end of the course.
Yeah.
No.
So I kind of agree with what you were saying earlier, Megan, about that distinction between undergrad and postgrad being quite important here. Because imagine with some of our undergrads, like, okay, now first years we're going to design a course together.
And
What do you want to know?
And they talk about that later on. I mean, they look, some of the papers say that and argue exactly that point, that to expect a first year student in the beginning of their undergrad program to expect them to know what they need to be learning, what is important, etc., is really challenging. And they're almost saying that you need to have students who are more experienced, who've kind of gone through the first couple of years of learning and sort of being able to, I suppose, bring something to the table because they've had some experience of a different style and perhaps how would they change it. Whereas again, some of the papers, one paper argued that no, the student needs to be involved right from the very beginning. And again, like you say, I think that's quite a big ask for someone who's completely new to the process. I mean, I think we've spoken about this before in terms of learning, where you kind of have to have this framework or rubric that students initially are exposed to and initially have this period of just observing and learning, and then thereafter asking them to become more actively engaged with the process and kind of finding their own styles and their own ability to kind of put things in practice in a way that works for them. And I think that goes to the same argument where you say, like, to kind of ask someone to be designing something from scratch when they don't even know what the expectations are.
At the ECAD thing on Friday, we had stuff on lecturing because a lot of the people there are early career lecturers. And there was a guy from, what is it called, CLTD, and he was telling us about how, like, the research on what people actually learn in a classroom setting or a lecture setting, that people who, like, you might enjoy their lectures, you might really like what they're doing. That doesn't necessarily mean you retain the content or engage cognitively with it. And he was saying, so like students might be like, oh, we love this, but it doesn't mean they're actually learning. and that some of the approaches that caused students to actually engage cognitively with the content, they're initially very resistant to and they don't like doing. So that was interesting to me in terms of like, if you want students to participate, they're going to say, let's do the fun stuff, right?
Yeah.
They're not going to say games.
Yeah. And I think, and also in the paper later on, they talk about like it takes, again, there definitely are biases to this process because it actually really only focuses on the small group of students that actually are engaged and actually want to be involved.
Yes.
If you're lecturing 200 students at an undergrad level, there'll be a handful that will be keen on sort of being involved in this process. But the majority, like to your point, Rona, kind of are just there and they kind of just want to kind of attend the lecture, go home and then kind of carry on with their day. That they don't want to be involved in such an intimate level. So again, I think it's definitely context specific and sort of the type of students and the type of individuals who sort of are involved in these studies, because I think there is some bias in terms of who will actually want to take up this type of process and these types of approaches to learning. So again, so they really wanted to focus on this idea of students acting as pedagogical learners in learning, teaching, and curriculum development. And they had two main research questions: co-design characteristics. How is the concept of students as co-designers depicted in the literature, and what purposes does it serve in the context of health profession education? And then in terms of the next question, they wanted to know specifically more about the study characteristics. How has the role of students as co-designers been studied in health profession education, and what outcomes have been reported? They then kind of, again, I found it quite difficult to kind of work through their thinking process of how this review was sort of laid out, because then they had almost like a little bit of a segue where they focused a lot on sort of these types of designs that are mentioned in terms of when they talk about these co-design or student partnership learning studies, that there really is this mention of three different approaches. It's the design-based research, participatory design, and co-creation. Again, I think there's quite a lot of overlap, but there seems to be some distinctions between them. Design-based research seems to be this iterative development and evaluation of educational interventions. Students are seen as users, testers, or informants, and there is a strong focus on theory generation and design principles. And I think that would probably fit best in terms of this long-term engagement, where it's kind of more, it is more of a top-down approach, but I suppose it's kind of the researchers and the educators kind of over time sort of doing things over and over and testing different things and methods, and then asking students how they sort of feel about these approaches. And then from there, there's sort of this development of theory and design. Participatory design is more a collaborative design with end users. Students are active design partners, and there seems to be more of a moderate focus on theory and a stronger emphasis on the process and participation. And then co-creation is a shared development of learning experience and curricula. Students are seen as equal partners and co-creators, and there's less emphasis on theory and a stronger emphasis on reciprocity and partnership. I think, they said they really wanted to focus on co-creation because there's this lack of theory and this lack of design principles and methodology and that. But again, I think by focusing on co-creation again, and where they say there isn't the strong emphasis on theory, it kind of is a little bit counterintuitive, I think, in terms of what they're actually trying to achieve. Because then it's saying, yes, the students are very much involved, but again, I think there's kind of then this really, not a lot of the studies that they end up using in the review. One of the big critiques is that there isn't much on methodology and much on reporting of how things were done. So, I struggled a little bit to understand why there was this big focus on co-creation again. when they're saying that it's not really a method that focuses a lot on the development of theory and processes, which they say is lacking. So yeah, it was
Doesn't really make sense. I mean, to my mind, it's actually quite useful to look at this as a continuum. For example, versus actively involved in creating it's a very different story.
And actively, I also was thinking, is it also about being actively engaged with like choosing the pedagogy or understanding the pedagogy?
And are students at that level that they can
could
actually engage with that kind of
and
theory?
understand that?
I don't know.
No, so that I think that is the trouble with this, is that it feels a little bit like pie in the sky, and that they sort of these ideas, but the actual how is really missing.
Do you think there's an element of abdicating responsibility? Because I'm just thinking, if I decide, okay, we're going to co-construct the course, I'm sure that would take a lot of work out of your year.
Potentially, if it's done badly, yes.
If you just said, okay, and then it wasn't my fault. You guys decided to do this.
But in the long term, I think it would create more work for you, because then you would have to undo and fix.
Yeah, well, if you were responsible.
If it goes wrong.
So, I mean, it comes back to pedagogies of teaching and what are you trying to do. So are you taking an approach, a sort of Reggio Emilia approach that we would take at nursery school in, you know, let them decide what they want to explore, versus actually you've got some content that you really do need to learn and understand, and how do we balance that with more novel pedagogies of teaching and learning.
And I think if you look at those early intervention things, you know, the carryover into other academic institutions isn't great. So,
this is is the experimental outcomes based sort of, you know, all of these.
It hasn't been shown to work, because I know top schools in Joburg have tried it with their junior, with their nursery schools. And very quietly shifted back to going through the more traditional, because eventually you've got to fit into a system that expects certain standards. And you know, how do you know what a speech therapist is qualified in if they co-design the course and there's not certain areas that have to be covered?
But I do think on the flip side, where we were saying like about the age of the students, like, I mean, and I'm sorry, I'm coming from very much the speech therapy kind of background, but like if I think about our fourth years, especially by the end of block one, so I mean, even that stage is like hard. I think it would be really nice to do some co-design with them, to say to them, like, what actually do you want in your adult seminars? What actually do you want in your pediatric seminars? Because a lot of them at the beginning of fourth year can tell you, I'm very shaky with trackies, I'm very shaky in the ICU, I'm very, and that would be, I think, an amazing time to actually say, could we co-design what are the elements that we need in these advanced courses? And I think that would be really, really helpful, because then I think you would also get student buy-in. So like, I understand this from the aspect of also wanting that student buy-in, and also kind of like, I feel like it's kind of like a freer approach of like, you are a knowledgeable other, you do have knowledge that you do need to bring, that we do need to bring together, and we in that respective
as well.
And so I do think you would have to be, I think it would create more work, like you said,
if it's done properly. It would be a lot more work, I think.
And I think it could potentially, especially it depends, I think, on the age of the students, the group of students, their personality dynamics. I think there's so many unknown variables in a very complex system that we wouldn't be able to account for, that it would almost be like, I feel like it would be hit and miss, depending on those variables.
And I think that's what I was going to say, is that I think it takes a very context-specific small group of individuals who, like you say, are keen to learn and have learning experience already. Because the reason I kind of became interested in this topic is that for my postdoc, I spent quite a lot of time with master's genetic counselling students, asking them about risk communication and the teaching of risk communication within their curriculum. And what are some of the challenges, not only in sort of taking that information and then applying it in a clinical setting. And I suppose I've been interested in end user experiences because I think there is definitely a shift where it's not the sort of paternalistic approach only now, where we, it's this top-down approach of saying like, this is what I'm going to tell you because this is how it is and this is how we've been doing it for years.
And I'm the expert.
I'm the expert. Yes. I think things change, and I think generations change, the world changes, socially, culturally, there has to be different contexts, and people do have the ability to bring things to the table in terms of learning. Students certainly do. And I think this allows an opportunity for student voices to be heard and for people to, like you say, sort of say, we've been taught in this approach, but we're really struggling to sort of grasp it or apply it. And this is, like you said, I'm really shaky on these areas and this is what I need help with. And this is actually, we've spent a lot of time focusing on this, but this is actually what we're struggling with. So I think there's definitely value in that. But I think to kind of do this as a blanket approach with a huge group of students, especially at an undergrad level, where, like you said, there's very limited experience. And there is definitely, I suppose, that shift in power and hierarchy is that you as the lecturer or as the teacher, you are going to have more knowledge and more experience because you've spent a lot more time in this area where you've got a group of students who've had zero exposure to this area or information. So to expect them and to put that pressure on them, and then to do it in such a big group, I don't know how you would coordinate it or do it effectively.
So you've really got to think about the how, why, and the when.
I'm thinking about the parallels with the ideas of like participatory research, of like getting like communities to participate, and it's something that it's nice in theory, but like and how do you realistically do that? And you can't include all of the patients. You can't include every patient at FARA in like choosing what the research project is, And there's also, I think, a place for being a researcher with a certain set of skills and a certain expertise in how to do certain things. Like you can't, like when I first read about that, I'm like, I can't, and I was doing my PhD, I'm like, I can't go to like all the parents of the autistic kids at the school and be like, okay, what research project should I do? Like they can't design a protocol. They don't have those skills. I think what they can bring is like, these elements of like, this is important or that is important. Like we want to know about this thing or we want to know about that thing, but they can't actually design the project. That's not realistic.
Yeah, so it's really about what's appropriate when, I guess.
Absolutely.
And with whom, at what stage, and why you want to do this. So there's a lot that you really have to interrogate and balance. And I think there's such a danger. I think they do speak about it later on, but this concept of just, we'll just plonk this in some way. And how does it fit into the bigger curriculum? And I know we've had these discussions around things like simulations and the review that we did. Often it's just plonked in some way without a concept of how does this relate to a broader curriculum.
So a few years ago, I think about 4 years ago, I had an opportunity to work with the Center for Health Science Education here at FIT. So they were doing curriculum design. And I don't know if they speak about this in the article, but with interviewing students, I noticed that there was a huge difference with the professional programs and the general Bachelor of Health Sciences program. So there was that difference because the other one is general and then the other one is more specific. So the professional programs like your OTs, the MBCH had more direction than the very general Bachelor of Health Science Education. So I think that difference also might help. But also what I noticed is that students were not familiar with all the learning approaches or the curriculum design and what's involved there. And really what they were more interested in is changing how they are assessed. So tests are not you shouldn't be the only way you assess us. Maybe if you can do this. So they were very assessment focused and not really they were not interested in the content and how they get there. But assessments.
Of course.
Yeah, and just linking back, I think, to the blog post that Joanne has posted, which was really excellent. This is a colleague of ours, a speech therapist in Australia, and she's posted about some of these challenges of including students, and when students ask for things that actually you can't deliver on as part of the design process. And then she also talks about this concept of, are we getting on the same page as the students, or are we trying to get them on the same page? Our page, you know. So what are we trying to do during a co-design process? Are we truly listening, and are we able to deliver on some of the things that students might?
And then there's issues of power, because like you're saying, I want to give you agency, and I want to give you autonomy to be able to design and choose what things are important to you. But if you provide an idea which doesn't quite fit or doesn't quite align with what I think will be appropriate, I'm going to sort of bring you back then to
my page.
To my page.
And what I saw also happening, they were focused a lot on, I think it was the top 20 medical schools and what designs they were following. So to increase the standard, they wanted to design something that is similar to that. Okay. But also when they talk to students, students have like a completely different idea of what they a completely different idea of what they want. So I think it's being realistic, how you want to give students agency, but at the same time you want to be ranked higher. So what do you?
It's so tough. I think of it of like, as from a parent, like you've got this newborn baby that has like no idea of the world, and like in terms of like gentle parenting, or kind of just saying, okay, well, the baby can just choose when it eats, when it sleeps.
I tried that. Like sometimes he's like screaming, and I'm like, you need to eat. And then like even when he was very little, and I'd like put him on the boob, and he'd be like, ah. And I think like if you were to take the baby's lead, you'd be like, oh, he doesn't want, but he did actually. And then once you get him on the boob, and then he feeds, and then he calms down. Like, okay, so maybe sometimes I know better than you about what you eat occasionally.
One would hope, you know.
So it's that balance of, who has the knowledge and the expertise, and how do we navigate this space,
and putting in boundaries to really ensure that like these ideas don't run away with students, or that don't serve a purpose of learning, or is not going to be useful in terms of sort of at the end of the day to get their degree, or being able to go into the world and practice as clinicians or healthcare professionals. So
I mean, it's like saying to primary school kids, how do you want to learn maths? And they're like, we want to run around outside. It's like, it's not maths, but
but it's even like what Siobhan was saying earlier with the ECAD thing. I was also listening to a podcast recently about like learning design for health professional education, and they were talking about literally going back to Zagotski's zone of proximal development, and about reiterating how you really have to find that zone, because that's where the learning happens, and it's normally challenging for students, and it's what's cognitively demanding, and initially is cognitively more difficult and takes extra work. And like, as a student, if I think back also to my students, I can remember student years. I remember poor Hazel Hazel was a lecturer in the department then, and wanted us to do outcomes-based education, and we had to go read up and learn things on our own, and we hated it. We completely like rebelled against it, complained, gave her horrible reviews, but like. But she was pushing us into that zone where we were out of our comfort zones, and where we were having to learn, and where we were having to push ourselves, but we hated it. And so I agree, you can't be like, okay, how would you like to learn? What would you like to learn? Because there's also, we've got that level of insight of saying, okay, how do we get them to that zone of proximal development that they don't understand?
He also
and a master's at a postgrad level, that might be more beneficial to do that approach. But I certainly feel at an undergrad level, which I think the majority of these studies have been on, I think
they need more.
And then kudos to the researchers who take on these projects, but they are, I think, are incredibly challenging.
I think one of the things that we also don't take into account is the stress of choice.
Yes.
Yes.
So if you say to a 7-year-old, run your life, that's child abuse. Because it's not fair. So yes, you can offer controlled choices, and I think that's what the article is probably saying, is that, do you want to do it this way or this way? Do you want the red shirt or the blue shirt? So you've got agency within an appropriate boundary. And I think that otherwise you are putting an awful lot of stress onto your students. It's not
and
fair.
it comes back to this concept of, we're supposed to be applying adult learning principles, but these often our undergrads are not at a stage where their brains are actually able to cope with adult learning, because the brain is not fully developed. So we're pushing them into a place where they're actually developmentally not necessarily able to cope. So I absolutely agree with that point, and something to consider of, do these kids actually need boundaries and scaffolding in terms of learning? And also just thinking about
safe.
What is their zone of proximal development
Absolutely,
actually for them?
Yes.
And just thinking about a lot of our typical students, in a class, you'll have maybe a handful at most who are like really enthusiastic and engaged in the learning. And those are the types who you could really stretch further. But a lot of students are just, if they even make it to the lecture at all.
And if they stay awake through the lectures.
They're just aiming for 50%.
So how do you actually bring this kind of an approach in with those kind of students? Maybe it would be amazing for them. Maybe it would wake them up and engage them. And I don't know, but I think one really has to think about the generation too. I just remember, when I was doing a bit of hybrid or teaching online, or I was doing blended online and in person, and the students said to me, "This is giving us COVID vibes. Can we just do traditional lectures?"
Awesome.
And that's what they wanted, was to be sat in a chair and just fed, spoon-fed information, and that's what they were looking for. And I was quite shocked, because I designed this beautiful online site that they had to engage with in their own time, in addition to what I was doing in class. And they didn't want that. That's awful. Yeah. It was awful, yes. But it made me really think that, often we're heading in this direction, and the university's telling us you must be doing blended, and this is so good for them. And actually, that's not what they want.
Yeah. And again, we need context. And I suppose, asking students, but and being flexible in terms of both sort of hearing each other, but then also being open to kind of finding a place that everyone kind of meets halfway and is comfortable with what the agreement is. I'm going to move on, because I see the
This is a hot topic.
But I'm really glad, because the point of choosing this was, I knew it was kind of a controversial topic and paper, and I wanted, I'm so glad there's been debate, because I think, I thought this topic would be controversial, so I'm glad that we've gone this way. Because we've run out of time, I'm not going to talk about the differences between a scoping and systematic review, but really to emphasize that a scoping review is not necessarily to test and show exact outcomes, but really it's used when the field is emerging, where terminology is inconsistent, and where a full systematic review is premature, and it's really to just explore the landscape and to kind of get an idea of what's out there in terms of literature on a particular topic. So this is kind of what they did in terms of their methods. They used 5 different databases. They looked at publications between 2010 and 2023. They only focused on empirical studies in health professions education, and they really were focused on co-design training programs. And it was only English language articles that they're focused on. So for the screening and analysis, they ended up, initially they had 703 papers, which they sort of reduced down to 84 after doing abstract screening. And then in the end, they had 20 articles that met their inclusion criteria. And then from those 20 articles, they focused on 3 areas, which were mainly basic characteristics of the papers, the co-design characteristics, and then the study characteristics. In terms of the papers that they used, they show just a distribution. I used a little bit of Claude here to kind of help me with my slides, but they put together it just shows the sort of the years in which these publications were done, and then the countries where the papers were from. You'll see the main countries or the main sort of studies have all come from the US, which again, I think the US, the way that they do things and think about things are quite different to some of the more sort of, I suppose, I would almost sort of say more conservative sort of approaches. I feel the Europeans can sometimes be a little bit more conservative in the way that they do things in terms of traditional approaches, and the USA, I think, can sometimes be kind of, I suppose, more liberal in terms of their learning experiences and that. So it was interesting that a lot of the papers come from there.
A big gap of nothing from the global
Absolutely
south.
nothing from the global south, nothing from South America, nothing from Africa, nothing from really Asia and the sort of those the sort of Asian countries. So again, huge gaps in terms of where these studies are being done, and really no voice in terms of experiences from developing countries and the global south. In terms of studies, what they were about, 10 of the studies included mainly medical students or physicians. Others were interesting. I don't know. I suppose they're health professions, but
They are in a way.
They are. But it was interesting that they were included in here. The study topics were all different. Some of it was focused on soft skills, others were on hard skills in terms of actual medical content and learning content. And then, like Sonto, you said, a lot of the studies focused on assessment designs, curriculum development, and governance. 17 of the papers were from undergrad program.
The lot of our discussion.
Yeah, 2 were from postgrads and 1 was an undergrad and postgrad, which is interesting, like you say, because I think the undergrad area, I think, would be far more challenging than a postgrad area to focus and do these types of studies. So it was interesting that those were the areas. And again, I think what is interesting there, these power issues again, that no study explicitly involves students in choosing the topic of the co-design activity. So
is it truly co-design?
It was the researchers and the I suppose the faculty staff or teachers saying, this is what we are going to be focusing on, and this is what we're going to ask students to explore or engage on. So again, there's no, in terms of the pre-design of studies, the students weren't involved in like the initial development and design and the proposal sort of creation of these studies, and that they were kind of again just plonked in as participants rather than being asked.
And sorry, I know we're like on a time crunch, but that's what also, like when I first read the title, I thought it was going to be more about, students being involved from that level of saying, okay, like let's come together from this at the top kind of layer, almost envision it. And I thought it would be more from that level of saying, okay, what would you like? Where actually the research didn't turn out to be like that at all.
And I think, and that would be one of my, I suppose, having looked at this review, if I was a researcher in this area and going forward, that would be a big gap for me, and a big thing that hasn't been addressed is that how can you, I suppose, from an authentic point of view, say that this is truly authentic co-design, because the students are not involved in the beginning processes at all, which would seem obvious. But it seems to be a big gap.
So again, there's this continuum of what do we mean by co-design, and at what point do we bring people in? And I guess it comes back to your point, Siobhan, about relating it to research with communities. At what point do you bring people in?
I don't work in this field as much as you do. But I'm wondering, how do you involve the students that early? Because then it does become very, very open-ended, doesn't it? Like, how do you get them to okay, pick what we're going to do?
So there have to be boundaries. There has to be some definition to this.
Some kind of structure,
not just a free ball.
In terms of co-design characteristics, there was a lot of terminology used across the studies. Student-staff partnerships or collaboration seem to be the most common term that was used. Co-creation, co-construction, co-production, students as partners, co-development, co-directors, student participation, participatory design. 7 of the studies provided a reference definition of what they mean by student-staff partnerships, and they used established literature to kind of provide a definition of it. And then 9 studies used different but related terms interchangeably throughout the study. So again, this co-design, co-creation, co-development, student-faculty collaboration.
Nobody really knows what they're doing here.
And then one study used the term student-faculty collaboration, but bases this on a literature about student-led collaboration. So again, there's a lot of terminology and no clear definition of whether they all mean the same thing or whether they are actually separate, actual concepts. So this is a problem within this area of research. The purpose of the co-design, I don't know if you've got your papers with you, but table 5 kind of provides a summary of all of this, but they kind of looked at course development for certain things like interprofessional relationships and communication, pain-related management, learning activities, revision of content. They looked quite a bit at simulation developments in terms of simulations, the actual doing of simulations, as well as the development of simulation scenarios. More stuff on assessments. So that seemed to be quite a big thing that came up in terms of assessment tasks, grading, evaluations, OSCEs, in terms of how students want this done. Again, there was stuff on the whole program, curriculum, and sort of broader institutional design of programs. And then in terms of educational interventions, in terms of how, I suppose, teaching is done sort of digitally or in classrooms, and that. In terms of who's involved, 19 of the studies said that they were all faculty, teachers, and instructors, and the students. And then 1 study involved what they called an educational facilitator, who was part of the study. And again, I think this kind of goes back to what we've been talking about all this time, is that there's varying years of experience amongst the students, and this issue of power issues, the issue of students not being brand new to learning for a particular degree, and really sort of how do you expect students to be able to co-design these things when they have had no experience or exposure to tertiary level education. The characteristics in terms, again, of the actual co-design process, some of the studies spoke about the time required for each stage of development and the overall process sequence. Some of the studies spoke about the different phases of co-design and the methods. However, a lot of the studies, most of these descriptions were imprecise or vague, and were often kind of limited to the discussion section. So there was no clear, this is how we did it, and kind of again, sort of a rubric, or I suppose this issue of transparency and
methods. I mean, that's just, from a research perspective, your methods need to
the methods need to be sound, and you need to be able to, like you say, like I always think, like if someone else was going to do my study, they need to understand exactly each step of how I did it, and so that they could repeat it essentially. I go back to that like quantitative way of thinking.
But we found the same with the simulation review that we did, that a lot of the time they were poorly explained, particularly in terms of how they interacted with the rest of the curriculum. So was it just an add-on? How did it fit in? There was very limited information. So, which speaks to a bigger issue, I think, in the health medical education literature around really thoroughly describing process, and maybe more attention needs to be paid to process papers.
6 of the studies did talk about this preparation phase, which I think is really key to these types of studies, is that prior to taking on any of the studies, although none of the students were able to choose the topic that they were going to be focusing on, and sort of the study had already been designed without the students being involved, which I think they almost need to take another step back and involve students at that level. I suppose what some of the studies did do is that prior to kind of starting with the co-design of the topic of interest, there was this moment of preparation for the students in terms of asking them, like, this is what we are aiming to do, this is what we want to focus on. So there was like a sort of a preparation phase and sort of a explanation of the purpose of the project and what the goals are, and orientating students to co-design norms, power dynamics, expectations, and potential challenges, which again I think are important and definitely necessary. But I think to take a step back and involve students right from the beginning of the design might be needed if this is truly to be called co-design. The study characteristics, again, I think I'm running out of time here, but really there are two different approaches to co-design. The one group of studies saw co-design as an actual method used as a means to design training content and define or a means to what they were actually trying to study. So it wasn't seen as the main focus of the paper. In terms of different research frameworks and yeah, I think I don't really need to go over this area, but they talk about different frameworks that they use. A lot of the frameworks come from psychology and self-regulated learning, inductive approaches, thematic analysis, and then they talk about these areas of theoretical framework of acceptability, evidence-guided redesign, and promoting action on research implementation, health science framework. I've not heard of a lot of these things before. And 7 of the articles do not present a clear research framework at all. 9 were mixed method studies, 9 were qualitative, and 1 was a quantitative study. And then it kind of just shows you the type of qualitative, quantitative tools that were used: interviews, focus groups, questionnaires, Likert scales. There was some statistical analysis for some of it. And yeah, I mean, they looked at 20 studies, but if I look here, they only mentioned 19 studies in terms of the data collection method. So there's one study which I read the paper again and looked at it, but there's one study which there's one missing, which I think if I was reviewing the paper, I would say, where's your other study? Key findings, and this is kind of, I'm coming to the end now, but really some of the factors that they saw that students see as facilitators to the co-design process. 10 of the papers provided a summary of all of this. I think students need to be proactive, flexible, respectful, open-minded, and the faculty members really need to be willing to work with students and compromise in terms of what they think is the approach or the topic of interest, and possibly, there could be different ideas in terms of goals and ways of getting to those goals. The organization needs to be important of the students, the faculty, and really the preparation for students in terms of instructions, prepping them for what to expect in a co-design process. The space needs to be really important in terms of how you choose the space, non-hierarchical, caring, encouraging, and the interactions between the participants need to be quite carefully thought about in terms of the environment and how things are negotiated amongst students and teachers.
That's a really useful kind of approach, even for other activities, I think, whether you're doing co-design or not. I'm just thinking about some of the simulations, the interprofessional ones, just thinking about different elements to plan.
Some of the effects of co-design on collaboration modes. Some of the positive effects that students found was that it overall creates psychological well-being and health. There's a sort of better sense making amongst students in terms of the task at hand. There's this idea of mutual listening and free expression, and I suppose allowing the voice of both teachers and students to be heard equally, and there's a sense of equality and confidence. one of the dangers or some of the undesirable effects is that this whole co-design process can be seen into this sort of therapeutic mode, and it becomes, rather than it become just a purely learning activity, it now becomes a process where there's like lots of debriefing and lots of students bringing up some of the challenges and things, which are all fair, which is kind of the point of it. But I suppose there could be separate spaces and places for those sort of things for students in terms of the appropriateness of timing of when these things occur. The co-design can sometimes be discouragement in the face of sometimes futile efforts. So again, we spoke about this being like, again, are these huge pie in the sky ideas, and how do you actually do this? Because yes, in principle sounds great, but when you're actually doing it and trying to design it and actually trying to act it out in a sort of a tertiary education setting, how do you do this effectively? And yeah, again, resistance from some faculty staff. I think, again, I think talking to what you said, Nancy, like you had a lecturer who tried this and it really went down like a lead balloon with her students, and possibly, again, other faculty or other staff or colleagues would say, well, we told you so, like it wasn't going to work. And then things kind of just moved back to how they were. And I suppose, yes, there are certain things that work well over the years and that, but it doesn't allow opportunities for innovation and change and new ideas, and for things to move and progress, which I suppose is the whole point in research and learning and these types of institutes that we are in, is that we are kind of meant to be at the coalface and driving change and driving learning. And
I think
thinking about how we do things.
Resistance doesn't mean it shouldn't go that way. I mean, like, so at the ECAD as well, he was talking about how, like, often the things that get people to engage, the students don't want to do. And I remember that. Like, I remember how, like, even in high school, we had a teacher who did things quite differently, and she would make us think about things on our own. And like, we were like the top performing class, and like our marks dropped for a while. But it took a couple of months, but once you like start engaging in that way, it's a completely different way of thinking. And for me, it like changed how I related to the subject entirely. But there was a lot of resistance, and a lot of the students didn't want to learn in that way. And I almost feel like some of these things almost do need to happen earlier, because there are ways that people become entrenched in this is what learning looks like. We sit in the class and people tell us stuff.
It's new information.
So that's what they expect. They get to varsity and it's like, well, I've been doing this for 12 years. Why, like, now you want to make me do something different?
Yeah.
Yeah, and I think, but sometimes I also think it boils down to also the lecturer and how they prepare the students. And almost like in simulation, we always talk about the pre-brief, but I think even when we're doing things and activities and that, like with our students that are going to stretch them, that are going to be uncomfortable at the beginning, how are we doing a pre-brief? So how are we getting our students buy-in, even from that level of like, okay, we're going to be doing co-design, or we're going to be doing this activity or that. How am I actually discussing this with you and helping you get into my frame of reference so that you understand why I'm doing this? And I think that's also massive, because sometimes we might jump in and be like, cool, we're trying this new idea, we understand it, we plonk it on our students. Without explaining.
But also they're coming from like, I mean, I think about my undergrad, and you're coming from, okay, you go and sit in this lecture and they drone on at you, and then you sit in this lecture and they drone on at you, and then you sit in this lecture and they drone on at you, and then you come to this class and Nancy's telling you, okay, we're going to do this, and you're going to get up and you're going to do this, and you're like, what?
Stay home.
That's not how everybody else is doing it. That's not how my day is being.
Just give me the slides
and
just drone.
Yes.
And it would be the lecture where there's roll call.
Yes, it's like, oh, you made me come here, and like when everyone else is teaching you in a particular way, I think it's like pushing a rock up a hill, because you're trying to get people to behave differently.
Absolutely. So overall positive effects: it enhances training content, it allows authentic, relevant, engaging, and contextually sensitive I suppose, development of curriculums and learning. It allows higher student engagement and emotional investment. Again, I think the caveat is that you have to choose students who actually want to be engaged and involved. So I think this might not work for all individuals and all students. Professional development in terms of confidence, communication, and leadership, and it facilitates gain of insight into student workload and I suppose student ideas and voices. And it builds self-regulated learning. Some of the challenges is really the power asymmetries persist even in partnership framing. There definitely are these student-teacher hierarchies that I don't think we can escape. Most students recruited are self-selected, motivated students, and does it only work for the engaged minority, or is this truly scalable? Several students felt input did not translate to real change. So again, I think again, they're these sort of like these small, again, I think, yeah, is this really scalable, and does it actually provide real change? And there's the risk of this therapeutic drift away from actual productive work. The faculty resistance, both institutional and at a personal level, and this is really time consuming and competing priorities for students. So again, I think this could potentially add work, not necessarily make things easier, potentially, especially in the sort of initial phases when students really have no idea what you're trying to ask of them. One of the big issues is really these methodological gaps. Most benefits seem to be self-reported. Recommendations focus on participant attributes rather than co-design strategies. There seems to be really no control designs. 7 of the 20 studies lacked a clear research framework. Small sample size of only 20 studies, all have different focuses, generally lack details of frameworks, methods, and outcomes. And learning outcomes really are rare. Do not really get measured.
And can you measure them?
And can you measure them? And almost all were short-term pilot studies, and the knowledge acquisition processes remain unstudied. In conclusion, I think I've kind of said what I needed to say here. I think one of the big things is that most of these studies are Western-based. Undergraduate and medical education, undergraduate programs dominate. Sorry, I think I made a typo there. And that medical education, there isn't that much on medical education, and there are major gaps in postgraduate areas and, like I said, in sort of developing countries. And yeah, what the field still needs: context-sensitive frameworks. Co-design should be theory-driven, structured, and practically effective. I talk a lot about these change labs, which I haven't, the author is Engelstrom, or seems to be the main researcher around it. And they are these collaborative spaces that help groups identify problems within their systems. And they reference some of the papers in here, which I thought was quite interesting. They kind of these change lab processes, which seems to be quite popular and effective. And it's not just used in higher education, it's used across different areas.
Sounds like a useful thing to follow.
So I was interested to look a bit at change lab research and some of the papers out there about that. And there needs to translate, student participation really needs to translate into meaningful, sustainable training improvements. And rigorous longitudinal evaluation of learning outcomes is still missing. And yeah, that was kind of it.
Thank you, Megan. That was a very, very interesting and stimulating discussion. And I think a lot of parallels for research that we would want to do as well, not just with students, but with other community members. So lots of food for thought here about our own teaching, about our own research. So thank you. Yeah, I'm not sure. I know we're running out of time, but if anybody online has an extra comment or something that they'd want to add, please let us know. Pop your hand up. Any final thoughts? Or thanks everyone for joining. So we will meet again probably in August. Take a break again in July over the back time. And quite a few of us are down at conferences in early July. So yeah, just have a good day further, and thank you for joining us, and have a read of the blog post that Joanne has put into the chat. It's really a very interesting take on how co-design actually works and a very honest reflection. So thanks everyone, and have a good rest of your day. Bye.
Bye.
Thanks, everyone.
Thank you. Bye.